Hey, hey, hope all's well. Go ahead and unmute yourself, type in, and let's do this.
All right, go ahead, Tracy, then Letty.
Hey, Miss Tracy.
Hi.
Mhm.
So I have a couple things. One,
You have way more than a couple things.
yeah, well, yeah. Uh, yeah. So my lovely husband has been working at our warehouse
Mhm.
nonstop every day for the last 3 weeks, trying to get it in shape and organize it. We lost one of our lead engineer that was keeping us from doing that because he
Right.
didn't want anything to change. Anyway, so Brian he takes blood pressure medicine, and the doctor gave him a stronger strength, and he told him one of the things that might happen is his legs might swell, and
Oh,
they're like swelling, and one of them, the one that he broke, is like really red. And so we've been,
what med is he on?
I don't know the name of it.
Okay, it's okay.
But he went back to the other one. He just decided he was going to go back to the other one until he could talk to the doctor. But I've been putting, sorry, lymphatic liniment on him. I've been using, last night I started using the Lovage and MSM.
Mhm.
And
And has that helped or no?
like he won't stay off of it, like,
Yeah.
and when I ask him to lift them up, he says it hurts. And I think what it is that, as the blood goes out, they start to ache a little bit if they're up.
Mhm.
But we've been doing Epsom salt baths and stuff. And I
How swollen is swollen?
do what? I'm sorry.
How much edema is there? How much is it swelling?
It's very tight. So like, because it's very tight, I can't really, maybe
But it's
fit.
the lower leg, it's increased in size, like down
Yeah,
like
like I was trying to think of, it's about 14 inches around, but he's a big guy anyway. So it's probably maybe not half as big more, but almost half as big more. I mean, look, and his
So
redness is kind of, but I did start giving him Cypress last night internally because
okay.
I read something that said Cypress would be
Yeah,
good.
yeah. Um, I, I know this might be hard for you to answer, but how much has he been urinating?
I don't know that.
Do you
Uh,
see him go to the bathroom a lot? Does he have urgency? Does he have issues like that? Or
well, yeah, he says he's getting older, so he has to go a lot more often than normal. But I haven't noticed him the times that I'm with him at the warehouse. I haven't noticed him going as much as he was before. That's a little concerning. But like I haven't seen him very much because I can't be on the concrete. It just kills
Mhm.
my back. So
I mean, two things. I mean, one you're already trying to address is, you want to go through and address fluid retention, and the other issue could be that the the blood is going down into the legs but not returning quite like it should, and so that could be like a vein issue.
I believe that,
Yeah,
especially that one that was broken because the redness is
yeah.
very vivid. And as much as I try to get him to lift them up as high as he can, he's a man. It's very hard for him to do things that
Yeah,
I
I
tell
hear
him
you.
to do, you know,
Yeah.
even if I ask nicely.
I'm I'm familiar with that owner's manual.
Yeah.
Uh, yeah. Well, I would say treating it for fluid retention is always good. I mean, it's good for blood pressure no matter what. But here you probably have a little bit of both. So I, I I would say treating the venous flow, the venous return back to the heart, which is tied to like vein health. And so you could use something like cedar, but rub it all over his legs. And the good thing about cedar is it also is going to have a diuretic effect as well. So, it's not quite the diuretic that like lovage or juniper or parsley is, but it's still, excuse me, it still has an impact. And so I would still give them the lovage, but I wouldn't make the cedar like into a body tonic.
So I
And-
have that cedar MSM. Do you
Yeah,
think?
perfect. Yeah, perfect.
And then
Ha-
give him.
Have him rub it on his legs. I mean, it'll probably make his legs feel better too.
Okay, good.
But the other thing that I would say is like probably get him on, like stop off at the health food store and get Gotu Cola.
Okay.
And the reason being that Gotu Cola also is a vein tonic, and it helps get the blood out of the lower limbs, and also helps with blood pressure. So
Okay.
you kind of have win in all directions with that one. Like, a lot of times what I'll do, and I don't think this is good for Brian right now because he's on meds that he's having reactions to and everything. But like, the first thing you usually do with blood pressure is you treat fluid volume. You basically you give them diuretics and try to flush out excess fluid so that the heart doesn't have to work as hard to circulate the blood. And then the next thing that I usually do is I use a combination of like Gotu Cola and like L-citrulline, or like how they have those blends for nitric oxide, and basically they relax the veins. They relax the veins. So part of the blood pressure sometimes is the heart is having to work hard to push blood through constricted blood vessels, and so I would be nervous about putting him on the L-citrulline or the nitric oxide just because of his reaction to his blood pressure med. Gotu Cola is it's just a vein tonic. So it's going to help get the blood back to the heart and keep it from pulling in the legs. And I think between the two, that should bring him somewhat some relief. But I'd also, and I'm sure you guys are already on top of this, but I would talk out the side effects with his doctor. Like if he's got I mean, he has a high stress job, so that he's got blood pressure issues is super, super, super common. And so like whenever I've worked for like CEOs or presidents or whoever, blood pressure, low back pain, and sinus issues are almost always the thing that I treat. And so I would treat that, but you are going to have an issue that if he's on a med that's causing that, you're not going to be able to resolve it very well. So he either needs to play with the dosage, or they put him on a different med, or him and the doctor will work that out. But to offset the symptoms, my experience though is like once this kind of starts to happen, you're prone to have it happening again. So I would develop the skill set of, we just got to fine tune what happens, what to do when this happens. And so let's start with these two things. And, so the lovage like you're doing, and then doing some cedar and I even like the idea of the Cypress. But I'd say the big one is the cedar. Like do the cedar.
So the lovage topically and internally.
I would give it to him internally. Topically would work, but he needs to pee out a bunch more fluid. Like
Okay.
topically would still do it, but he really needs to pee out a lot more.
Yeah, he does. Okay.
Does he have a prostate issue at all, or that we're aware of?
No, not that we're aware.
Yeah.
You
Because
know, but
the other issue is if there's a little bit of a prostate issue, sometimes because of the swelling, the kidneys and the bladder aren't able to like urinate out as much as they should. And so what starts to happen is the bladder and the kidneys start holding on to that fluid, and then it starts trying to disperse it by just ditching it out into the body. I mean, he's at the age where
yeah, he's
probably
55 this year.
yeah, probably doesn't. If he does, it's early stages. Usually with something like that, it's like huge. And so it's usually later stages prostate issues. And so I'd stick with what we're talking about. Do that, see how he responds, but I'd have him talk with his doc, because this could be a side effect of the medication, but it also could just be something that's also happening. You know what I mean? It might not be that it's a side effect, but um, is he checking his blood pressure every day?
No.
He like I would feel a lot more comfortable for you guys if he was just, it's at the office, you sit down and you check it, and then that way you get a good idea or a good reading of where the blood pressure's at. And
No, he has his Apple phone.
yeah, but I don't think it does blood pressure. I think that does pulse. Like it
Yeah.
does pulse and like oxygenation in the blood, I think, are the two things that it does. It doesn't really do blood pressure.
Yeah,
At least I'm not aware of it.
it does.
Yeah.
Okay.
And so like just, get him a cuff, like a little electronic cuff, and just like check it, once or twice a day. And what I notice with people is like sometimes with the blood pressure, when we're younger and we kind of push and we get a little wound up about something, it's no big deal. But as we get older, it's a little harder on the heart. And, it might not be that the activities change, but there's times where you can go, okay, you need to be a little bit less wound up about this. So there could be like some low grade anxiety. There could be, like a glitch in the sympathetic nervous system, where it's not a balance between sympathetic and parasympathetic. And so one of the things that, we try to treat with oils or try to treat with herbs, but one of the things that I've been using on a few people is there's these devices that you can get like on Amazon that stimulate the vagus nerve. And, you just put it on your neck and it's basically a very specific like TENS unit.
I have one of those. You put it
Which
on
one do you
your
have?
ears. I have the Alpha Stem. You put it on your ears. Would that be the same thing?
It probably is. Like the one that I usually have people get is Pulsetto, but that's probably the same thing. I mean, you're putting it in about the same place. Pulsetto, you don't put it on the ears, you put it like right below the ears, and um, increasing parasympathetic activity, which you're basically increasing vagal tone, in theory, reduces blood pressure. It improves digestion and it reduces blood pressure. That's even like one of the things that we're going to be talking about in that regeneration of the digestive system is anytime you're really having digestive issues, what you're really saying is I have issues with vagal tone and parasympathetic activity, because rest and repair, another way of saying that would also be digestion and, well, yeah, digestion and other things. And so blood pressure elevates when there's excessive amounts of sympathetic activity. And so, things like there's the Vagal tone blend, but things like tarragon and marjoram and, sage, anything that has lemongrass, anything that has like parasympathetic toning to it would also be good for him. Just throughout the day, a couple drops of water, inhaling it, putting some on his wrist, any version of that. I kind of like the idea of marjoram just because it's very good about pulling the body back into parasympathetic activity. And, it's antispasmodic and, it just kind of makes you feel good. And you could go crazy with it and it would still be okay. Like,
Okay.
you could put a few drops on the wrist and that would be good. You could put 30 drops on your back and you'd still be good. You know what I mean? You can kind of go nuts with it. And so,
Okay.
yeah, I like that idea.
So,
Yeah.
yeah, I will try all that with him.
Keep me posted though. Like, because as much as he travels, the veins are going to be more of an issue as he gets older. All
Yeah,
the flights, the
it's
flights
that
are hard on the body.
and that concrete he's been
Mhm.
standing on,
Yeah,
and
yeah.
that is really hard.
But
Well,
I have a friend who used to have to fly a lot to Europe back and forth. I think it was Europe. Can't remember where he was flying. I want to say it was Europe. And he, in a short amount of time, he had to do a lot of flights. And he kind of blew like some veins out in his legs. And it's just because of, the elevation and the cabin pressure and all that. And so this could be a complication of that, which again, the gotu kola is super helpful for that. The gotu kola and the cedar. Yeah.
so it sounds like I'm gonna have to add some oils to his travel kit.
Add some oils, and I would probably have him, like, when he flies. I mean, he might not like this, but compression stockings.
I was gonna say I just bought
Yeah,
him two
yeah,
pairs to try to help
yeah.
that.
Super good for him. Like super good for him.
He hates anything tight on his legs, so it's gonna be
I hear you, but he can take them off when he lands.
yeah.
But like when he's flying, just it allows him to not have the side effects of all those flights.
Okay, that's good. So my other thing was so I woke up, I was fine. I got to the office and my low back, I don't know what I did, but it's been screaming at me all day. And I thought I rubbed I have marjoram with CBD that I rubbed
Mhm.
on it. And then I ended up rubbing on the belly and the right, so it's on the right side of my right at the where the hip bone goes into the spine.
Okay.
And then in the front, about where my appendectomy scar was. So it's like
Okay.
almost right in front, all the way through. And I don't know.
And so the pain is side to side, up and down, or right in the spine itself.
The pain is kind of up and down.
Okay, so that's psoas.
On the back.
Put some like if you have nerve help, put it on the back, like where it hurts, but then inhale Palo Santo and kind of go in like through your navel and sex chakra, perineum, the Ming Men, the basic, like just hit all that area, and you can kind of feel where the tension's at. Inhale it um, with that in mind, and even the nerve help. Do the org programming with the nerve help.
And auric programming.
Yeah.
It's down. And then inhale the Palo
Yeah.
Santo.
For the org programming, it's nerve help is the oil that's for the nervous system.
Okay.
Yeah.
Yeah, my nervous system's probably jacked up.
Yeah. You guys are busy and you have a lot of stress and
Yeah.
you have a lot of people pulling on you, and you have, like you said, somebody who left, and you have a lot of displacement that causes a lot of stress.
Yes.
Yeah.
And then I had one more thing, and it's really
Sure.
quick. So I found this is a question about Master Choa. Um, if that's okay if I ask.
Mhm.
So I
I love
found
it.
me too. I found a CD that's Twin Hearts for physical healing
Mhm.
and or self-healing, and it's from Sri Lanka. Do you know if they're different
I
based on
don't. No, I
places?
don't.
Okay,
I
that
don't.
was my question.
Sometimes they are, sometimes they're not. It's hard to say. Like every area did their own recording sometimes, so it's not always universal. So
Okay.
I don't know.
I'll listen to it and let you know.
Yeah.
If it's in English.
Right.
Thank you so much.
You're so welcome.
And then go ahead, Letty, then Lolly.
Hey, Miss Letty.
Hi, Greg. Hi, Sam. How are y'all doing?
Hey, how are you?
Good, good. Greg, I have a couple of questions. So I decided to do summer school again, but this time I'm going to be in charge of the program.
Yay.
So, so I had a question about that. So, I'm supposed to meet everybody on Thursday, I believe. Yeah, Thursday. And I'm taking over this position that somebody has been doing this for like over 15 years. And the only reason this person can't do it anymore because he's an assistant principal.
Mhm.
And the contract it would overlap each other.
Okay.
So he can't do it. So he wanted me to do it, but I just don't know how everybody's gonna feel about that. So I was just wondering, is there something I could put in the room
Yeah, drop the
that
F-bomb a lot and talk about the Illuminati like all the time. It'll go fine. uh, I'm sure it'll be fine. If you want it to be like you said, where people are
receptive?
receptive and a little bit more open, um, do you think they're going to be resistant, or it's just new, or like what do you think is going to be the issue?
I think they might be resistant because the person that normally has been doing it for so many years is no longer can't do it. You know what I mean? It's not that he doesn't want to, he just can't. But a lot of these people have been used to him like the same person. And it's gonna be new for everybody. And I'm just afraid that they're gonna be like,
I'm going to throw one out there that's you probably wouldn't think of. Cistus. Try throwing some cistus in a diffuser.
Mhm.
And so a couple of things. Like you said, people are used to what's already been happening. So they're going to be super in their left brain. They're going to be super intellectual about it, which means this is the way we've always done it. And they're not going to be open to
and I'm not trying to change anything.
no, but still it's still a change,
Mhm.
Like I had this teacher one time that always wore the same color shirt. And somebody asked him about it, and he goes, yeah, if I started wearing different color shirts, it would confuse the mind so much that you'd focus on my shirt rather than what I'm saying. So, it had nothing to do with new information. It's just people don't always handle change very well, right?
Mhm.
And so the cystis will balance out their mind, but part of what cystis does is uh, it helps allow something to like come in.
Mhm.
Like if you watch people talking and they're kind of talking at each other, they're not really listening, they're not letting it in. They're like, yeah, but at most sometimes in those kinds of setting, they're being quiet, waiting for their turn to talk. They're not really listening to you. You know what I mean?
Mhm.
And cystis hopes to let information come in so that you can process it. Like you actually kind of go through and go, oh, this is what they're saying, and this is rather than yeah. Now it's my turn,
Mhm.
and that's what you're kind of shooting for. And we haven't used this term very much, but you know, a lot of people are behaving associated with what you would call the glamours, right? And glamours are just like these emotional patterns that people act out on. They're partially tied to, like, you know, how when I talk about automatic behavior and automatic thinking, part of it is you're reacting to emotional patterns within yourself. And you know, you almost like take on certain tendencies, or like a person, excuse me, a personality almost has like certain properties to it because of the glamours, good or bad. The thing with Cistus is it breaks down the glamours. So you have a greater potential for a shift or a change, even though you're not changing policy, you're changing, you know, you're still going to have little variations, like how you do it versus how he does it, how people interact with you, and even when you're doing something good, like something that the person would like, they a lot of times have prejudged it and are a little bit put off until they have experiences. You know, then the experience makes them kind of shift or change, right? And so the Cistus will help you facilitate them having the experience and shifting. It's almost like, you know, I was thinking about this like the other day when we do our like Perba practice and Dorje practice and everything. And, you know, most things that we do, we think of it as, okay, this is a technique and this is the technique and how we do it. And, you know, what are the steps? But with those practices, it's not so much about what's being taught, it's about where like that practice takes you. So it doesn't always look the same, right? It's not always the same over and over again, because you're kind of working the group and then you're taking them to a place where they can have this inner experience. You're wanting to do that same exact thing, but in the workplace. It's not so much what you're saying to them or what you're teaching them or the parameters you're given. You're trying to walk them to this new place where they have a different set of experiences, or they perform differently, or they perform basically under your guidance. And it's a lot like doing a group healing, but you're really just shifting them to, like, you know, there's a new, it's not even that you're doing a new way of doing things, but because it's you and not him, it's going to be new to them.
Yeah.
And so it's about where you're going to take them. So it just allows you to put your personality into it, your parameters, what you think's important, you know, how you guys communicate, you know, all those little things, all those little nuances. It's just going to help put that in motion.
Okay.
Yeah. Like when we're doing those Milong ceremonies, like a lot of times when we burn incense, what the incense that I burn is Cistus. And it's simply for that. It's to be able to help facilitate taking somebody somewhere to a place where they can heal or shift, rather than this is the technique. Like, and you know, that process is different every time. And so, you know, people go, oh, what are the steps that you do to that? And I'm not joking when I say this. Like, I don't know. I don't know until I sit down, I sit there, I process and kind of tap into everybody. I have no idea what's going to happen. I mean, there's certain things that are always going to happen, but there's things that you just don't know. And you're processing things in the moment every time that you're having an interaction with that group, and you're trying to move the group to like being more effective and more efficient. And Cistus is one of the best oils that you can use for that.
Okay.
Yeah.
Now, I had another question kind of in the same realm. Like, since I'm going to have access to the building,
Uh-huh.
I kind of want to do like some sort of
Can I
like
say one more thing about the Cistus?
Yes.
You inhale it before you interact with them as well.
Okay.
Like that way it makes you like a better facilitator for what we're talking about.
Okay.
Yeah. I mean, you're good at what you do. I'm not saying you need to improve that, but it just allows you to take in where everybody's at and work with them where they're at rather than a preconceived idea.
Okay.
So, okay.
Thank you. So the other thing was, I'm gonna have access to the building that we're gonna use. It's actually our brand new building that I'm in. And I wanted to kind of do a cleansing, but I also want to, I kind of want to also have the building ready so that we have a lot less incidents kind of type of thing. Like, I don't know if it's something that we can control or not, you know, because we're getting, when we do this type of summer school, we're getting like some of the worst kids throughout the district, you know.
You're talking about just the environment being one where there's just been instability through people's behaviors and things over a period of time.
Yes, I want to kind of keep it as calm as possible. Like I want it to,
Lemongrass. Yeah.
so I can like go and cleanse all the rooms first and then like
Yeah, make
and
a
then
spray bottle of lemongrass and go around and spray everything or burn lemongrass incense or something, but like a lot of lemongrass in the space. Lemongrass is very stabilizing to chaotic environments.
okay. Yeah, because it's kind of what, you know, some of the classrooms are going to be a little chaotic,
Yeah.
bringing in those.
It's school, and like you said, you're dealing with difficult cases and you know, like I heard a great explanation sometimes, like, you know, like you said, like in maybe the last, you know, season or two or three or five, there's been difficult kids there, and there's been maybe acting out or whatever. And it's like when you burn toast, you know, even though the toast is done and burnt and in the garbage can, that smell lingers for a while.
Mhm.
You know what I mean? Like
Yeah.
that same thing happens when people have been chaotic in a space for a while. Like there's an imprint that kind of lingers for a little bit.
Okay.
Yeah. I mean, I know you know that, but like I just find it an interesting way to think about it. Lemongrass is a really great way. It's cleansing somewhat, but it's more stabilizing. Like it's just like if there's little remnants of chaotic energy, it's just stabilizing to all.
Now, do you suggest that I like do this lemongrass at the end of each day? Like, of course, I'm gonna do it before, like, but
Yeah,
do you
it's a
think,
way to like kind of close out the day. You could totally do that. Yeah.
now would it be okay to do like Moses first of all, just to cleanse everything, or like maybe some sage or something?
Sage might be nice. Yeah.
Okay.
Yeah.
I have another separate question, Greg.
Sure.
This is different. For excessive perspiration, that's obviously something lymphatic going on, but is there a pH for that? Like,
Oh, you just gotta go through and do psychotherapy. Yeah. But one of the best things for frustration is Lang.
okay,
Lang will calm down frustration significantly.
okay, I said excessive perspiration,
Pre-
perspiring.
Oh,
Perspiration.
excessive perspiration. Oh,
Yeah.
yeah, forget what I said about Lang. Cypress, use Cypress for that. Cypress, even sage would do it a little bit, but Cypress, is it mostly armpits and like palms and feet, or is it everywhere?
It's everywhere. Like, but I know like also like you have to think about like San Antonio, how hot it is here, but like
Yeah. Cypress, use Cypress.
Cypress. Okay. Like would that just be okay, just like a couple of drops on the wrist?
I would probably take it internal.
Internal.
You could still put it on the body. I mean, that might be helpful as well, but definitely take like 2-3 drops 2 or 3 times a day.
Okay, so let me ask this. I know it's good for the body to perspire, right? To get everything out.
Yeah, but excessive is not always good as well. Like something's up, like
so that's what's wondering, like, what's
granted,
going
you
on.
guys have a lot of heat. Like
Yeah.
it's super hot right now. So, the thing is, like, excessive perspiration can be an issue, just like not perspiring. And so you want to kind of have it be like kind of normalized. And so the Cypress, any time you have like the loss of fluid, like you're vomiting, your diarrhea, whatever, like part of what you do is you use Cypress, and it doesn't necessarily stop the nausea and vomiting, but it helps you to hold on to some of the fluid. It helps reduce the body kicking off so much fluid. But it's even like excessive sweating, but even like you know how sometimes, like, say you're in a meeting, you go, okay, this is what we're going to do. Nobody talk about it until we announce it in a week. And so nobody talk about it, especially at school. And then everybody's like, okay. And it was like, okay, nobody talk about it. Clear? And then you walk out, and then within 5 minutes, somebody's going, hey, this is what we're going to do in a week. And they just, it comes out of their mouth.
Yeah.
It's like, it's this thing about, there's like an energy in the body that's just about like letting go of, like, its vital essence, you could say. And like even Cypress helps with that, like talking when they should, or saying things they shouldn't, but it's in the body, it's letting go of fluid that you shouldn't, excessive perspiration, just anything like that where it's too much releasing, especially of fluid. Cypress is really super good for that.
Okay. Now, what does that stem from? Do you know, Greg, like when we're perspiring a whole lot?
It's probably an imbalance of the nervous system. Yeah. I mean, it's hot there though.
Yes.
You know what I mean? Like you're
hot.
going to be sweating no matter what.
No
But
matter what, yeah.
like heat can start to throw, just like cold can throw off the nervous system, heat can throw off the nervous system as well. And so, yeah,
Would
you're.
some sage also help? Like,
It possibly could, but sage tends to help more with like night sweats and things like that, where it's a little bit more hormonal.
mhm.
Or this could be hormonal, but it's probably just the body's, like the vital, like what we would call vital centers. They're just they're a little chaotic, and they're letting things go too much.
And is there a difference between male or female, or it's the same thing?
Same thing.
Same thing. Okay.
Yeah.
Okay, sorry, Greg. And one last question on
Sure.
someone who has carpal tunnel on one arm. Is there a pH for that? Like, what would you work on?
Probably the best thing to do is to put antispasmodics on the forearm.
Okay.
Yeah, like marjoram, black pepper, because like if it's true carpal tunnel, like doing this, like a person with carpal tunnel can do that, right? So the issue is that a lot of times people, physicians or whatever, they have to have a diagnosis to be able to give a medication. And so anything wrist related, they'll say carpal tunnel, but there's 8 tendons going through this tunnel in your bones with the median nerve. And so what happens is the tendons become inflamed, or they've contracted, which makes them bulge a little bit. And then so when they go like this, it compresses that nerve and then makes it go to sleep, or radiates electricity or something like that. So treating the forearm with antispasmodics is like how you reduce that and make that go away.
And when you're saying that they can't, like when you're the motion that you're saying, like putting the 2 wrists together, like if they can't do that, then that means they have it.
Right. If they can do that and they're having wrist pain, it's not carpal tunnel. Like it's probably more the neck and the shoulder.
And if it's more the neck and the shoulder, what would they use?
Still use the antispasmodics, like up on the neck or the shoulder. I would probably use more like up on the neck and shoulder, more like spikenard and vetiver and, things of that nature, like things to relax that down. But have them do this and see, and they might be able to do it, but it will hurt, right?
Mhm.
It depends on how bad it is.
Mhm.
And so, yeah,
Okay, alrighty. Thank you so much, Greg.
you're so awesome.
I'll let you know how it goes for
Okay.
summer school.
And then go ahead, Lolly, then Ralph.
Hey, Lolly.
Hi. Okay, let's start. So many things. So when we're doing the advanced Moses technique, you're going from the navel to the Mingman, and then going from the Mingman back to the navel, you're going through the belt meridian, the kidney belt meridian.
Right.
Can we when I do that and so can we talk about that? Like why? Like what's the significance of that meridian? Because I'm just wondering what's
So when you move it from the navel back to the Mingmen and then float it around the kidney belt meridian back to the navel, you're like cooking the kundalini, and it's making the kundalini energy is like really thick and moves really slow. And like the idea of like cooking it is just a term, but basically you're making it more fluid so that more can move up.
and the way to do it is going through that
Mhm.
specific meridian.
Mhm.
And then
Well, it's not just the meridian, it's the navel back to the Mingmen and then floating it back to the front. Like
okay,
that whole process is what's doing it. It's not, the meridian isn't doing it. It's the shooting back from the navel to the Mingmen is actually
Right.
doing
And
it, and then you're floating it around the meridian to get it back to the navel.
right. So I do get the process and I get this thing. I guess I was just wondering about if there is any significance, even for other things, for that specific location, for the belt meridian. Is this something that
Just if you're working on the kidneys.
is helpful in?
Yeah.
Okay. Okay. So that was okay. Thank you. And then okay, so surgery. So I was working on this person now for I guess almost 2 weeks. It's been going really well. So I'm doing pH. So she has some incisions on her abdomen. So, and I'm actually working pH and it's been working really well. But what I'm wondering about is what would you do topically if you have incisions after surgery, and specifically if they're starting to get kind of inflamed, possible some infection. Like I wasn't sure if it's like
Are
myrrh
they
or
closed?
do you use?
Are they closed?
Yes, they're closed. One of them looks a little bit worse, but it got to a point that yeah.
Helichrysum.
Helichrysum? Okay.
Helichrysum will help that area to bind. It reduces inflammation, reduces the scar tissue, has like a cleansing effect, like a physical cleansing effect if there's still a little bit. It makes the blood more fluid, so it's more penetrating to that. Like there's so many reasons why to use helichrysum on that area. Yeah.
Okay.
Yeah.
And then and the fact that there might be and if there's some kind of an infection, it still will take care of that.
What makes you think there's an infection?
That's what she's thinking based on how it looks and how it kind of felt to her.
Yeah, I
Like
mean,
there's
it's
a little
probably
bit of kind of white ridge.
yeah, it's probably inflamed. I mean, infection's possible. Like if infection's always possible, but it's probably more inflamed than anything. And so I would treat it as if, and then if it doesn't resolve, if you want to treat it for infection, like bay laurel internally, or bay laurel is really good because it's a broad spectrum antibacterial, like really broad spectrum. So, you can even have her put it on the skin, but definitely 2-3 drops a couple of times a day. But, the infection is probably more her fear of what's happening than what's happening. It's probably like, those sites can get pretty inflamed. And so it's probably more inflammation than anything. Like if you can
And
reduce
then,
the inflammation, I mean, the issue is though, I mean, if it's inflamed for a long enough period of time, it is more prone to infection. So, I mean,
right.
she might not be far off the mark. She just might be a little bit ahead of herself.
Okay. So that's, yeah, I wasn't sure and basically, so because you mentioned before that you would put helichrysum even if it's like an open wound, so you would do the same thing
I
even if
would,
it's still.
but the thing is like after somebody's had surgery, like I don't want the doctors to bust their chops about things, so I never say put the helichrysum on a surgery site, just because I don't want them to have a weird thing with their doctor. But if it was a
But
like
realistically,
cut or an
yes.
open wound, yeah, I would totally have them do that. But usually with a surgery site, I tell them wait till it's closed, then start putting the helichrysum on.
Okay. And if
Yeah.
it looks kind of close, but it's still in process, you would still wait. You would still wait.
Like
for doing
there's
that?
still little sections that are oozing.
It's actually not oozing. No, it's pretty. I guess it's pretty. No,
Pretty
there's
close.
one that's a
Yeah.
little bit more. They're closed. They're just don't look pretty yet. I guess it's that.
Yeah. How long ago was it?
We can on Thursday. It's gonna be 2 weeks.
Yeah, you could put the
Yeah, it looks pretty close actually.
I mean,
Yeah.
you can put the helichrysum on something that's brand new, but like I would feel
Okay.
comfortable with doing the helichrysum, 10 days out.
Okay.
Yeah.
Sounds good. Thank you. And then, oh, so okay, so we talked last week about the
Yeah, I
whole
want to say one more thing
situation.
about like if for some reason hypothetical, if for some reason there was a bit of infection, so bailoral internal and on the skin, but you could also use tea tree on the site.
That was it. Okay.
That would be another thing you could do. Tea tree is amazing for
Mhm.
that, but
Yeah.
again, it's probably more inflamed than anything.
Yeah. But and then tea tree, you would just put it topically, you wouldn't take it
Yeah.
internally,
Yeah.
even for infection.
No, just topical.
Okay.
Yeah.
Okay. Thank you. And then last week we talked about my situation with like all the noises around and
Oh yeah.
doing sacred blue. Yeah,
Yeah,
so
yeah.
sacred blue is like great. It's like my new best friend. It's awesome.
Right.
I sleep fine. I also have amazing, like I have these really, really vivid dreams.
Yes.
So that's really cool. So that's working well. The issue is, which I'm noticing, is that my problem is during the day. And it's not, so it's when there's noises, and also I'm more sensitive. I think I'm just more sensitive than other people. And I think I've always been like that. Even as a kid, I used to do that. So I don't know if there's any way to kind of
Sensitive to what? To like noises, to stimulation? Noises.
Like I can hear stuff that other people are not even bothered by it, but I hear that. And yesterday I realized that even as a kid, it's always been like a thing.
Does it ever feel like you're waiting for the other shoe to drop? Like you're
Yes.
Yeah, okay.
Depending where. So depending
Yeah.
here in this situation with the building,
Yeah.
yes.
Did the sacred blue help that at all?
I'm not sure. It was amazing for other purposes.
Right. So
I'm not
the
sure.
thing that you like, you're going to have to experiment a little bit. So I would say there's two choices right off the bat. One would be some form of sage, and if you have blue mountain sage, that would be the one I have. But if you don't have that, just use whatever sage you have. Like, so wear it on your wrist, inhale it. Part of the thing with sage is it reduces the hyper reactivity of the sensory nerves. So basically it makes your body less sensitive. And
I already do that. I already put that on my wrist, and I just got the body.
And then just like you inhale it
So
all the time. Like I have to do that sometimes
yeah.
after doing certain kinds of meditation. I go out and it's just like every little thing, I just feel it. And the sage will tone it down a little bit. The other thing to use would
Okay.
be some form of lotus. Like lotus can actually help that quite substantially. Like you'll still
more
be
than
aware of it,
and I
but it will
started.
be won't be as over, like you'll be aware of it, but it's not like overstimulating. You're
So-
processing it, but you're almost like non-reactive to it.
So I just started the Spedry Blue Lotus.
Yeah. Like take that a
Yeah,
couple
so I
times
just
during the
started
day.
that. Okay.
Yeah.
So I'll experiment with that. Okay.
That actually should help quite substantially. You'll notice that just like
Okay.
things will be going on, and you're just like, yeah, I'm chill. You know,
Okay.
you still might
I'll
hear
try.
it, but like you don't have
Yeah.
that like, the other
It's
shoe's gonna drop it
yeah.
anytime.
Yeah. And yesterday, I don't know, maybe because I was catching up on the generational healing, yeah,
Mhm.
on the weekend.
Mhm.
So I don't know, maybe because of that, more things all of a sudden came up, and I realized that I was, and maybe it's triggering something from many years ago. I don't know. And it's all connecting together.
Did you get to the part in that class where you do the chords with the father side of the family and the mother side of the family?
So I listened to everything, and I need to finish some of the practices later tonight. I haven't done that
How
yet.
far did
No,
you
that's
get?
happening.
Like in far as doing the processes, you know what I mean?
A, B, C. I did C. I'm gonna start with D tonight.
Remind me. C is
I
the
don't.
directions.
Yes. I finished the directions last night.
Yeah.
Yes.
Mm. Instead of progressing through the class, stay at that spot and work the north. And with the north, work it on the back knee, the ankle, and the soles of your feet, like multiple times.
Okay.
Knees, ankles, and soles, you say?
Yeah, knees, ankles, soles of the feet, just over and over again. And then
So
after you do
just
that, then do the aura. You know, do the quadrants of the aura, but
still with the north.
just do the north, and don't progress to the doing the things with the father side, mother side. Like wait till that kind of calms down before you move on.
Sounds too complicated to do the rest.
Yeah, like well, it's just that part is very simple, but it's very intense. Like it's very intense. And so do it from a place of stability. Like don't go into it feeling like and then try to do it and push through it. Like it's better just to wait till everything's like calm and then you go through and do it.
Okay. Also, the timing that I did everything last night probably wasn't ideal because there was some family stuff going on.
Yeah.
But it's fine. It's giving me clarity on other things, which is really good. But okay, so do the north a few more times. Okay, thank you. And then so just do that tonight a few times, do the 4 quadrants, and then kind of see how I feel before I'm doing the rest.
Yeah.
When I'm doing the rest of them though, do I need to go back again and do No, I can just okay. Thank you.
Yeah.
Cool. Okay. Then astral projection.
Mhm.
I've used that before. I have it from another class. Now I have another one. I worked with that last night or the last couple of days. Last night, yeah. What's in the blend? Because I don't have it in my notes for some reason.
Let's see. Ginger lily, tolu balsam, acacia, and benzoin.
Okay, thank you. Okay, so that's about that. Now, rosemary.
Uh-huh.
So a few questions about that.
Sure,
What
sure.
is the difference? What's the difference between rosemary, like regular rosemary that even you have like on your website without like any type of specifics, and rosemary verbena or one of the others?
Rosemary verbena has a little bit stronger effect on balancing out the body and all the systems, and a little bit stronger for liver function. The regular rosemary a little bit stronger for circulatory functions, you know, but other than that, the rosemaries are very similar.
Okay.
Yeah.
And then
Like
and then a couple
I would say they're both good for stress, but rosemary verbena is a little bit better for stress in the gut. You know, and you know, the gut
Okay.
usually turns into stress in the sinuses. And so I tend to use rosemary verbena for sinus related issues rather than rosemary. Rosemary would work, but rosemary verbena works better.
Okay.
But like if I was treating like a joint issue, regular rosemary would work better. Like both would work, but regular rosemary would work.
Okay. And then okay, I'll do this one's an easy one. So then rosemary is also good for the hair, right? Because it kind of stimulates the
Mhm.
scalp, kind of hair growth, and okay.
Mhm. Yeah, not
What
only
would
does it
you-
stimulate the scalp, but all forms of rosemary are what you would call a cephalic, which means it doesn't just stimulate circulation where it's at, it stimulates and moves blood towards the head. So that's why it's really good for the scalp, is it's not just increasing circulation to the scalp, but it's making the body push more blood to the scalp.
Okay. Oh, that makes sense. Okay.
Yeah.
And then what would you do with like a itchy scalp?
Itchy scalp,
Also?
I would probably, I mean, you could do a couple of things. You'll have to try, like lavender or a chamomile, like rubbed into the scalp could be helpful. But a lot of times, you know, what I start off with is spikenard. And the reason being, it's very balancing to the skin. And, you know, sometimes the itchiness, you know, it can be dandruff, it could be just itching, but it's things are a little over agitated. And sometimes there could be like a little bit of low-grade psoriasis on the scalp, and it would just help calm all of that down. Another honorable mention for not just the itchiness, but also for scalp health and hair growth and things like that is sage. And like you would still massage the sage into, like in the shampoo, like into the scalp. And the thing with the sage is it helps with the effects of like hormonal imbalances, that like sometimes the hormone byproduct or hormone itself gets like stuck in the scalp, and it helps flush that out of the scalp as well.
Okay. And the rosemary you wouldn't really use for that specific thing because it's not really.
What's that?
Would you use rosemary as well?
Rosemary, I mean, it might help with itchiness, but probably the lavender or chamomile or spikenard will work.
Yeah. Okay, sounds good. Now, another question related to rosemary, because I have like contradicting notes and I'm like, I need to figure that out. So if we're talking about the color prana of the oils, so rosemary usually would be a little bit more red, right?
Well, like when oils have been manipulated, they'll stay one color, but like when they're a genuine oil, they'll cycle through like 4 or 5, even up to seven colors. So rosemary tends to start off red, you know, as long as it's not blended with something, but rosemary verbena is more green.
Oh, okay.
But they cycle
So
through different things, and it depends on
yeah,
like the region that they come from. Like it's not like set like all rosemary does this. It depends on the
Right.
region, the altitude, how hot or how cool it was distilled. There's a lot of factors. A lot of times when people are talking about that, they've been playing with oils that have been manipulated, and the color doesn't fluctuate because it's not, doesn't have the vitality or the life force in it that essential oil does. You know, because like when oil evaporates, you know how the scent changes, the colors change of what's present.
So basically, yeah, so it'd be one thing when you scan it, and then a
Yeah.
little bit later.
It's really hard to do things by color. It's really, really hard
Right.
to do things by color.
So then, okay, so then if I'm looking at, you know, when you have, let's say, a cancer patient, right? And you wouldn't use red, or areas in the body where you wouldn't use orange, talking about color prana. Does that
It's
have
different
any
than-
equivalent to the oils?
It's different than projecting energy at the body. So those
Right.
rules kind of don't apply quite the same.
Okay, so I have different notes, which is why. So it will be, and that applies to any oil, not just the color oils that kind of make the body produce the color. So
Right.
it's not relevant for. So basically, I have, let's say, simplest example. I have, let's say, cancer patient losing their hair. Would you use something like rosemary on the head, even though it's a, you know, supposedly red energy?
They're losing their hair because of chemo.
Yeah, that's an,
I
it's like
wouldn't
an adjacent.
treat it. Like I wouldn't treat it. It's
Okay,
not
so
gonna
that, so
not gonna change anything, and their body is too easily overwhelmed. And that's I mean I know it's like something that they're wanting to address, but I would spend the time on other issues. That is pretty low on the totem pole. Like their nervous system has
okay,
to be supported quite substantially, and the generation of that chaotic energy, which is Mingmen and basic, and more than anything, that back solar plexus has to be cleaned, like substantially cleaned. And you know, no matter what you do for the hair, like you know, like after the fact, you can help it grow back a little bit faster and everything like that, but
so
I
and
wouldn't spend a ton of time on that.
okay, that was just an example, which I
Yeah.
thought was simple. Apparently, it's not. So that was good info.
Like
But okay,
it's like with that, the body's too toxic, and even the thing with chemo, like you don't even want to detoxify the body right off the bat, because you want, I mean, they're already going through the chemo. You want to let the chemo do what it's going to do. Like you detox it like after the fact. Like, you know, let
yeah,
let the chemo do what it's going to do, and then afterwards help the body process and get rid of the chemo. And so I don't even do detoxification like while they're going through it. I just keep supporting the nervous system, keep using like nervines and things that are very supportive of nervous function. And you know, if somebody was going through a crisis, you would even support the glands. But with cancers, like I don't even do that, because some of the cancers are fueled by endocrine function. And so I wouldn't even mess with playing with glands until they're over their treatment process. You know, just focus on the nervous system,
yeah.
focus on the immune system, and just keep it in that realm for the while.
Okay.
Yeah.
Thank you. All
Yeah.
of that was just to basically get to, okay, so, but still, you would use any oil on anybody. Like there's nothing that you would, like you wouldn't say, oh, it has like a color, like you wouldn't, your reasoning wouldn't be based on the color prana of the oil, right? because, and I'm asking because I have some other notes, not from you, saying that like you wouldn't use something like rosemary that
It's
has
different. It's
red
different
front.
than like projecting energy. It's like it's a different set of rules.
Which makes sense.
Yeah.
Right.
Yeah.
So basically it doesn't
Because
matter.
like
So,
even when you look at a plant, like they're talking about projecting energy and it just hits the body and the body assimilates it. But here you're
Mhm.
using, you know, like you put rosemary on, it doesn't necessarily fill the body full of red. It's going to hit particular
Mhm.
systems. Like it's like
Yeah.
you would stick your hand somewhere to direct it. It's like that. It's already directing it to a certain area of the body. It's not going to do across the board.
Okay.
Does that
Thank
make
you.
sense?
I just
Yeah.
because it does,
Yeah. Yeah.
because I had other notes in a couple
Yeah.
of places about that. I was like, I need to
Yeah.
make sure that I'm understanding correctly. Because
Yeah.
yeah, okay.
I
Thank
mean,
you.
I wouldn't
Um,
push it. Like I wouldn't like if somebody had cancer, I wouldn't use things that are super stimulating,
yeah.
like cinnamon or something like that.
Mm-hmm.
It would still probably be okay, but I still don't do
Yeah.
it. You know, just because
Mm-hmm.
it jumpstarts all the body systems and it does like strengthen the function of everything and it strengthens the lower centers. So I mean I would still stick
Mm-hmm.
within those parameters, but it is a different set of rules compared.
But yeah, but it's based on what the oil would do in the body as opposed to
Right,
what is the color prana of the oil.
right,
Okay.
right.
Thank you so much.
Yeah.
Okay, perfect.
Yeah.
And then another question that I don't know, I'll ask, but I'm not sure if you can even answer that. So, I think using the sacred blue and doing, I don't know, more healings, more meditations, whatever. So I've been seeing different colors, right?
Mhm.
And I know some of them are not meant to be used in the same way I'm using, you know, the pranic healing colors. Some of them are used in a different way. What I'm wondering about is like, is that one of those things, like it's gonna come to me what to do with that when the timing is right?
I'm not sure if I understand the question. Like say that again.
So I'm seeing other colors other than what I used to be able to see before. So I have more of a spectrum
Can you give me an
of
example?
colors. Like blue. So something that's more of like, I can't even really explain it. So it's not really electric blue or icy blue, but it's somewhere along that. Like if you would put a lot of white with a tiny bit of blue, like when you explain sacred blue, when I listened to that the first time, I got it as a concept. Now I'm getting it in a different way as actually
Gotcha.
seeing something.
Yeah.
This one is not being used in healing in the same way as the other colors are. I know that. I have a feeling on how I can use it. I'm also seeing other shades of like, I think green, violet, but in different ways.
Yeah.
With some of them, I'm not really sure yet, like how to use them. And I'm wondering if that's one of these things, like the same way I got the color, I'll get the knowledge of how to use it. I know it's
used
like
to
very
the colors
general.
for a little while and it's like they have a personality. Get used to their personality
Okay.
and it will start to sink in like how to use them.
Okay. I knew you would have a good
Yeah.
way of explaining
Yeah.
it. So
like this is what I would say about that. You know, there's two ways of doing something like when you're doing healing. One is to follow a technique and one is to like have an inner guidance that's based on like a mystical approach. And when you start tapping into those kinds of energies, it's not going to be in the realm of technique. Like
yes.
technique in those colors, like it's like mimes and clowns. They don't like each other. You know what I mean? Like
Yes.
it's more of a spontaneous kind of energy rather than, you know, because a technique, you're still using a bit of intellect to kind of go through, and which is fine, right? You know, it's still good.
Yeah.
But you know, you're doing steps to produce a result. But when you start working with these like higher vibrational colors, it like what you'll do with them won't make any sense to the intellect. Like the intellect will be like, wait, what? Like in the intellect will keep going, no, let's do this. But it's like it's pigeonholing, or is that what you call it? Like you're sticking it in
Mhm.
a square peg into a round
Mhm.
hole. Like it just doesn't fit, you know. And,
Mhm.
and
Like,
so
yeah.
you know, you'll run those colors at some point, and when you bless, and sometimes it won't even
Yes.
be that you run them, but like you invoke it and they kind of come down and are present in a
Mhm.
situation. You know, like say you're
Yeah.
creating a healing space for something and you start doing it, the color will like kind of descend. And it won't
Mhm.
necessarily be like a projection from your hand.
No, it's different. Yeah.
Yeah.
Mhm. Okay. This is exciting. Yeah, thank you.
That's very exciting.
And
Good for you.
I work completely different than what I used to work. And
Mhm.
I have sessions and I'm like, oh my God, I don't even sometimes understand how, like, I don't know. I'm like, oh wow, okay, this is working. This is great. Well,
Mhm.
thank you. And yeah, but it's a totally different experience. So thank you.
Very good.
I'm gonna ask one more thing,
Sure.
and that's the last one. So when we're looking at phobias,
Mhm.
so today I found something out, so I'm kind of like, let's go with that. So basically the person it's not, well, it is kind of a major now. So the person has a hard time with complete darkness, right? So he has to sleep with a little bit of light on always. And he's been doing that all of his life. I never knew it was a thing. Today I found out it's a thing, apparently since he was a kid.
Mhm.
It's actually my dad.
Mhm.
So, and you can see the difference. He needs the light on, I needs the darkness and the quiet. So yeah. But basically it came up because he has to do a cataract surgery. And it came up today in a conversation because this is the part that kind of it doesn't feel comfortable with when it's all dark and he needs to like wake up, just make sure that he can see and that everything is fine. So I can treat
How
it
far
at
away is this
pH,
cataracts? How far away is this cataract surgery?
week and week and a half. Yeah, a week and a half or so. Oh no, 2 weeks exactly.
2 weeks?
2 weeks, yeah.
Okay. You know how in auric and somatic programming, where you do the brain, the spine, and then eventually down to the feet,
Mm-hmm.
um, do a version of that.
Yeah, I always do that.
Will he do oils or no? Or
No.
do it with
It can diffuse,
do it
it
with
can
energy.
diffuse some, it can
Do,
diffuse something, but I want to have the time to get him.
do it with energy. But like
Okay, so I,
instead of going just down to the soles of the feet, do the back of the knees, the ankles, and the soles of the feet. A lot
so
of what is causing the phobia most times is down in the knee down, and then it's in the spine, and then it's in the right side of the brain.
Okay. Yeah, I started doing that now on each, yeah, so I do brain, spine, feet. And would you do EV on
But
everything?
don't use fancy colors, just use white.
Why, okay.
Yeah, yeah.
Yeah, okay. Because
Yeah.
otherwise it's not gonna be.
It's well, like the thing is you're trying to match the vibration of what you're treating.
Mhm.
And sometimes when we use like really fancy oils or fancy energy, the vibration's too high and it doesn't address the thing. So treat that and then clean his lower centers. Navel, sex, spleen, Mingmen, basic. Yeah.
So would you do white on everything,
Yeah,
or would you do
just white.
colors or EV?
Nope, just
Just
white.
white. Okay. So
You'll
even,
get a much better
and
result.
what,
You'll get a much better result.
yeah. And would you do, so even if I'm treating other things with him, like his shoulder or other things, would you still do white on that, or on that you would do some color?
Start off white and then eventually move into your colors.
Okay.
Yeah, in
I'm
the
so
session,
glad I asked.
like
Yeah.
start white
Mhm.
and because you're wanting to treat the body is is very gross, like not like icky gross, but just it's
Yeah.
low vibration because it's in form. And sometimes when you're doing healings, the thing that makes it not heal very fast is you're using too high of a vibration. So like you go
Mm-hmm.
down to like really low vibration and then eventually work your way up.
Yeah, makes sense.
Like cancer patients, for
Would you
example,
do?
I start with white
Mm-hmm.
and then eventually move to colors. Eventually. Sometimes it's
Okay.
a few sessions even.
Mm-hmm.
Yeah.
And then would you do, so then even doing any psychotherapy or not even?
Well, the white will do a form of psychotherapy. Because a lot of what turns into a psychological issue starts off as physiological responses. So they're like
Yeah.
they're really low part of the emotional body, and the
Mm-hmm.
higher colors don't really address it. Like so, even doing the white has much more of a therapeutic effect than people think.
Yeah. Yeah, and we forget that when we start playing with
Yeah.
color.
Yeah, well, it's fancy.
Yeah.
You want to do the new stuff, like I get,
Mm-hmm. Yeah.
I still do it,
And yeah,
but like
thank
you
you.
just go
And
down to the basics and you just grind it out with the low vibration energy and then slowly elevate it.
okay. Yeah, and I'll do thank you. And yeah, I don't even know. I mean, there's something in his childhood probably. There's some trauma there that he never talks about. So I
Well, I
don't
would
know.
say if he's having surgery in 10 days, it's going to be hard to work on his shoulder because he's probably stressed out and
Oh no, I'll
yeah,
do
yeah.
no. So
So
but I
I
was
would,
thinking,
yeah, yeah.
I was
Get
thinking
him.
addressing that fear. That's yeah,
Oh yeah, yeah. Yeah,
yeah.
that's usually a byproduct of all that water that's been under the bridge, you know.
Mm-hmm. Yeah. So yeah, I was thinking of doing like pre-surgery and post-surgery and do mainly just
Mhm,
focus on
mhm,
relaxing the body, dealing with this fear that I never even knew about.
mhm. Where is he at right
Yeah,
now? Where is he at?
he's in Israel. He's
Israel.
in Israel.
Yeah.
Yeah.
Is
So
he
that's
doing
why I need to
okay with
send him
everything?
something.
Is he doing okay with everything
It's
going on
okay.
over there?
Yeah, he's okay. It's a lot of mess there. Yes,
I
all over the
I
place,
don't know.
but he's okay. Yeah. So yeah, thank you. So yeah, and then I'll send him, I have to put together a list and send him some things so he can actually,
Mhm.
start using it on the body. Yes.
Perfect.
Okay. Thank you so much.
You're so welcome. Keep me posted. If you need something, let me know.
Okay, perfect. Thank you. Thank you.
And then actually go ahead, Ralph, then Denise. I know you lost your turn there, Ralph.
Hey, Ralph.
Hey, hi, Greg.
Hey, how are you, my friend?
Well, first off, I have to cautiously report some massive improvement here. And I'm saying cautiously because I've had a problem with my computer that's basically rendered it inoperative, and I had to grab my wife's computer this afternoon,
Okay.
10 minutes before class started. Okay. So while class has been starting up, I've been madly trying to get a system together to be able to talk to you. And
wow.
I'm
And you
not
pulled it off.
I'm not screaming obscenities at the universe.
Oh, nice.
So I want to
Computers are good for that.
yeah. Yeah, well, we've talked about some of my energy patterns in the past, so I want to cautiously report some massive
Nice.
improvement in the way things are going. So
Yeah.
so
Good for you.
yes,
Doesn't
this
that
is
feel good?
it feels great.
Yeah.
It feels great.
Good.
So thank you.
That makes me really happy for you. Good.
Yeah. Also, been using the on my face.
I have to tell you, just like on that same note,
Yeah.
I don't own a computer. Like for that reason, like I
Yeah.
use iPads, and
Yeah.
if there's something that needs to be done on the computer, I hand it off to somebody because my mantras that come out of my mouth when I have to do things on the computer are not very wholesome.
Yeah.
I just don't do it well. Like I just don't. So
Right.
I
Okay.
feel you on that one.
Okay, good. So anyway, on my face, I've been dealing with a bunch of scars and open wounds
Right.
and stuff, and we've been using the myrrh.
Right.
Scabs are falling off, and I actually have healing skin that is formed underneath the scabs,
Okay.
which is another massive improvement.
Good.
So
Good. And like, so when you get them wet, are you able to like scrub them a little bit, or are you told to not scrub them, or?
yes, I'm washing my face. I've got a little silicone scrubby thing.
Mhm.
Looks like it looks like the sort of thing I'd wash dishes with, but it's very
Yeah,
short,
I know
very
exactly what you're
soft.
talking about. Yeah.
I'm able to use that, and everything's holding together fine.
And so does that remove some of the layer that's above the skin? Like, does it, like the scabby part, does that pull some of that off, or?
no,
Okay,
the scabby part's still there.
still there.
So
Okay.
and the skin is unaffected by this. by
Okay.
this.
Okay,
So it's looking good.
good.
Um,
Again, I'm very happy for you with that. Like
thank
that,
you.
that very good.
Yeah. So I was digging through my oils and found Moses blend, and I was going,
Huh?
Moses blend? Does that go well with Moses technique?
Yes, that's well, it cleans the second layer of the aura, like the structural part. So
Okay.
physical blockages in the body, so in
Mhm.
your anatomy and things like that.
Yeah.
And if I remember right, I think that's what digestive system. Let me look that up. I
Okay.
can tell you real quick.
All right.
That is Santo.
Yeah.
I put in SA and it says, "Do you mean Sandofarm?" Yes, I do. So digestive system, enteric nerves, your fascia, potential trigger points. So
Mhm.
it's good for that, but you could also use it for the Moses technique. And the reasons why it's called Moses is you know like that Moses technique, that pattern was laid out in a very metaphorical way by Moses, and the instructions were to use hyssop and cedar. And
Okay.
the Moses blend uses hyssop and I can't remember, it's like I think 4 different kinds of fancy cedars.
Mhm.
Just because back then they used to use the cedar that came out of Lebanon. And the closest thing that there is to Lebanese cedar is Atlas cedar. And so I have that in there, but I also put like Himalayan and I think it's Japanese and might be Taiwanese as well, just because they're like really, you know, they smell good and they're really fancy, potent cedars. And so it has a very strong cleansing effect. And if I'm right, hold on, let me look up one more thing. Part of what you're doing when you work with cedar and hyssop together is there's this thing in Buddhism called Vajrayana, and it basically means moving the mind from speculation to having the cognitive abilities to recognize your true nature. And part of that layer of the aura that you're working with the Moses blend is actually tied to that process. And what Moses was putting forth with using those two oils, and you know, sometimes you use them individually and sometimes you use them together, but hyssop is very activating to the heart and crown, and cedar like mixes the energy of the heart and crown. So basically you're connecting the incarnated and higher soul, like you're, you know, because you're the throat being the void between the upper centers are higher soul oriented, the heart down is incarnated soul oriented. And so when you mix them, the connection between the higher soul and the incarnated soul is increased. But what Moses was putting that forth for was karmic issues. Like he basically said, you know, use this process and do it 7 times for karmic issues. And back then, the karmic issue that they usually were talking about was what's that condition where the body gets all
Leprosy?
yeah, they were treating leprosy. And so they would refer to it as a skin related condition, but it's basically the basic chakra is just super filthy, and there's a little bit of a bacterial infection. And so it's a way to clean up the form. Like you're basically cleaning up the form, because anything basic chakra is form oriented. And so you're cleaning up the form so that more soul energy can flow through the body and resolve the health issue.
Okay.
Yeah.
But
basically the technique is, you know, heart, the more potent form is back, heart, navel, crown. But if you want to direct it like to a certain area of your body, like say you had a bad shoulder or something, you would put your awareness on your shoulder, but your awareness would be on the front heart, then let it go, and then do back, heart, navel, crown. And then repeat, just keep repeating.
Okay. So it would start off on the front heart with also attention on the area of interest.
Right.
Like shoulder, knee, whatever.
Yeah, think of the heart and what you're thinking of like programming what you're going to work.
Right. And then you go to
You let it go,
back
and then
heart.
you just because that process will purify the body, but it will also it has a purifying effect on the chakras.
Okay.
Yeah.
So in class we did the advanced Moses technique.
Yeah, it's stronger. Yeah.
So if I really get excited, just do the whole advanced technique.
Yeah.
Okay.
Yeah. And it's a great one to take a salt bath in.
Okay.
Yeah.
All right.
You know, I have this friend who she's a medical aromatherapist, and you know, she's a little bit religious, like very Christian. Like I don't tell her what I do because I'm sure she'd think I would be associated with the devil. That kind of Christian, you know what I mean?
Yeah. Yep.
And but like she uses that same, you know, she uses a version of it where she mixes hyssop and I think just Atlas cedar. And you know, one day we were chatting and she started talking about it and she goes, I don't know what it is, but it's just magic. It does things that I don't even understand. And I was like, I hear you. You know, because it does
Yeah.
those other energetic things.
Mhm.
But you know, I couldn't say like it does energy stuff. She'd be like, you know,
Yeah.
you know, and so I just go,
Yeah.
I know it is magic,
Yeah.
but literally,
Yep.
yeah,
I won't tell her from a physicist's point of view, magic is just technology we don't understand.
yeah.
Let's not get, don't
And
get too
magic,
detailed. Don't get too detailed.
yeah, magic is just the ability to harness the laws of nature. That's all
Yep.
magic is. That's all
What,
it is.
whether the law of nature is currently acknowledged or whether it's something we're
Right.
still discovering.
Right.
Yep.
That way.
Welcome to Lawrence Livermore Labs. Anyway,
Right.
that's classified. We can't talk about that. Anyway,
Right.
so speaking of Moses technique, the other night I woke up at my 2:30 in the morning, and it occurred to me to start doing Moses technique with a mantra. And I played with a couple and didn't really hit on anything that really lit me up. If you were going to do Moses technique and do a mantra at the same time, what mantra might you choose?
Well, that's a very juicy question.
No, I love
Well, what can I say? You and I kind of think down the same track.
Well, you have a couple of things that you could use.
Uh-huh.
So if you're just doing general healing, I would say Om Mani Padme Hum could be a thing that you use. But I think you're looking for something juicier than that.
And if we wanted to turn it up to 11?
Yeah. So I would use a holy name as the mantra.
Okay.
And I would do the holy name. Were you on this last weekend?
No.
Okay, so the holy name is for the Ming Men.
Okay.
And even though you're not putting your awareness on the Ming Men, you're stimulating transmutation and you're stimulating establishing order both within the body and like order in how you interact with the environment. And so I'll spell it for you and then I'll tell you how to say it.
Okay.
Okay, so A-D-O
A-D-O.
yeah, N-A-I.
A-D-O-N-A.
That's all one word.
Okay. All right.
And then the second word being T, Z is in zebra,
Yes.
A, and then B, and then A again, and then O-T-H.
Okay.
So I would say this like very, I wouldn't say it out super loud, like say it, you could whisper it, you could say it kind of on a low voice, or you can just say it internally.
Mhm.
But you kind of break it up into like syllables. So you would go E, Do, Na, E. So that would be the first word.
Okay.
So A and then D-O and
Yep.
then N-A and then the I.
Okay.
And then the second word you'd say Za, like T-Z-A, and then Ba, and then Oath.
Okay.
So watch, like just close your eyes and I'll chant it a couple of times.
All right.
E do na za ba os. E do na za ba os. E do na za ba os. Oh, that feels nice.
Yeah, that's good.
How's
That's
that
good.
feel?
That's
Yeah.
good.
Yeah. So like inhale it, do a cycle, say the name a couple of times, and then just keep repeating the cycle. Because the holy name will deepen what you're doing with the centers. And then so here's the other thing. Like we talked about it on the weekend, but I don't know that I've talked about it very much in previous classes. Maybe a little bit. So when you're going back heart, navel, then crown, right? So
Yep.
do a couple cycles of that and say the name, right?
Okay.
But like I'll tell you what I'm doing, and then I'll walk everybody through it.
Okay.
So, do we have a bunch of questions still? Like, because we could just do the process.
I say let's still do the process. We do have a
few-
14 and
few-
3s.
okay.
but-
Okay. So let's do this. Pull out some hyssop or Moses or cedar. You could also use tuberose or ginger lily for this as well. Sacred blue. Okay, so your awareness is on the back heart. Take some nice, long, slow, deep breaths with whatever oil you're using. Then to your navel. And then to your crown. Okay, so just be still, let go. I'm going to say the holy name a couple times. E do na za ba o. E do na za ba o. E do na za ba o. Begin inhaling with your awareness on the back heart, so between the shoulder blades. Okay. 90% of your awareness is on the back heart. 10% of your awareness is on the navel. So you're just mildly aware of your navel. Now begin increasing your awareness on your navel while decreasing your awareness on the back heart. So if like your awareness is 90-10, then make it 80-20, then 70-30, 60-40, 50-50. Then the navel is getting stronger, 60%, 70%, 80%. Now your awareness is just on the navel by itself. Now 90% of your awareness is on the navel, 10% is on the top of your head. Slowly increase your awareness on your crown, 20%, 30%. Your crown is the majority of your awareness now. It's becoming less and less on the navel. It's fully on the crown. And then just let go. So you're just being still. E do na e za ba o. E do na e za ba o. E do na e za ba o. Your awareness is on your back heart. Begin inhaling the oil again. 90% on the back heart, 10% on the navel. Slowly begin moving your awareness from the back heart to the navel. You're increasing your awareness on the navel. It's fully on the navel. %90 on the navel, 10% on the crown. You're increasing your awareness on the crown. Your awareness on the crown is increasing. It's increasing. Your awareness is fully on the crown. And then just let go. E donna za ba o e donna za ba o e donna za ba o How does that feel? So like Ralph, do it like that.
Okay, thank you.
Yeah,
Yeah, that's nice.
yeah, yeah. It's a good thing to do at night, like before you go to bed or if you can't sleep. Yeah.
Thank you. I don't know, Ralph, did you have any other questions or shares?
Nope, that's it for tonight. Thank you.
And then go ahead, Denise, then Channing.
Hey, Denise.
Hi, Greg. How are
Mhm.
you?
I'm doing good. How about you?
I'm doing pretty good. I had that thing that you told me to really work around my neck and I think maybe up into my jaws, but
Mhm.
the first time I did it, I used just spikenard.
Okay.
But it was really bad last night for whatever reason. I'm not even sure quite why. So I used the olive oil and the spikenard, and it really took that. I had to really work up in my scalp and up into my temples, and but it did do it. It did the job.
Okay, good. Good.
I didn't have to
So,
resort to
how is
anything
it
other than-
today? Like, how is it today?
Actually, it was pretty good, except now it's just moved down to my right shoulder. And it could be because I've done more today a little bit too. I was like washing
Could be
windows.
that, and sometimes when you have an area that's like a hot spot, that other thing is going on, and you can't really feel it because of the hot spot. And then when you diminish the hot spot, it feels like it moves, but that spot was always there, and so you're just now able to perceive it more. Because like pain is a really weird thing where, like the more something hurts, the more you won't perceive other pains in your body until it resolves. And then all of a sudden you'll resolve it and you go, now other things hurt. They were always hurting. Your brain couldn't perceive it.
And that makes sense because actually that shoulder was bothering me for
Yeah,
about 3 weeks.
yeah.
I meant to ask you about it, and then it really shifted up. But
Yeah,
so
yeah.
should I continue with the spikenard or
Continue with
nerving?
it and then kind of take it down into the shoulder, just like you're doing, but still treat that area up high,
The other.
but
Yeah.
then go down into the shoulder. Yeah.
Oh, that sounds good. Can you tell me, I also have bug bites. I got attacked by bugs. So is there a good one for bug bites?
Like lavender, chamomile,
Okay.
tea tree would work. Lavender and chamomile would be my first choices. Is it inflamed?
Yes.
Try the chamomile.
Okay.
If you have it. If you don't, lavender. But also do you have anything that's like an antihistamine of any sort? Be it
Yeah, but
herbs.
Benadryl or what?
Yeah,
Or
if you don't have quercetin or something, take a Benadryl, because part of what happens with like a bug bite is you are having kind of an allergic reaction, and the Benadryl will calm down the inflammatory response. Still treat it topically, take the Benadryl, and it should resolve it pretty quickly.
okay, thank you.
Yeah, yourself up.
I have nettle quercetin too and
Yeah, that
Benadryl.
would work. You could do that
Okay.
instead of the Benadryl. Yeah.
And then what is Spasmophilia for?
It's for inner health rays, but it also is for spasms that happen in the body with a moderate amount of stimuli. You know how like sometimes you'll be doing something and just a little bit of movement and something goes into a spasm. And we don't use that term a lot in the US, but in Europe they refer to that as spasmophilia.
Oh,
And
interesting.
so yeah, so it's it could be like a splinting of a joint. It could be, you see it a lot in the neck and shoulders sometimes, where just a little bit of movement, or sometimes like stress or strained breathing, any of that, and it will fire off and go into like a weird kind of spasm. And so it just helps to reduce those kinds of spasms.
Would you take it topically or
Topically,
internal?
yeah,
Oh, always topically with
Yeah,
that one.
I mean, you could take it internal, but the benefit wouldn't be the same. I would use it just directly on the spots.
On the spot.
Mhm.
Thank you.
You're so
Okay, I have one other question. Now, this is for a friend's daughter that's having really bad gallbladder pain.
okay.
And she's just not able to eat without having either diarrhea or throwing up or being in terrible pain. So,
Okay.
and the only thing I know she recently got was bile salts, and that's
Okay.
all I really know. Her name's Mallory. Do you pick up anything?
So Does she have they said gallstones or what did they
I
say?
asked that. I did, and no, her mom said no, she's not had any gallstones, no kidney stones. She's never had any kidney problems either. But I kind of feel like her grandma, would be
Mhm.
Mallory's grandma. She just seemed to have a lot of health problems, and I kind of feel like it was,
Right.
yeah.
Well, could be that the gallbladder is super inflamed. Let me look something up here.
Okay. Thank you. She was working for a dentist, but she has no insurance. And so she's very upset about this. She's upset, so I had kept
Yeah.
feeling like it was somewhat emotionally involved too, and I think she's angry over all this.
Yeah. Yeah. So, okay, so we don't think there's gallstones. It's most likely probably an inflamed
Okay.
gallbladder. And so even if there's stones there, like the thing that I like to do right off the bat is I treat it with peppermint. Like 2 or 3 drops in water like a couple of times a day, and it will reduce inflammation. And if there's stones, anything that has menthol in it will actually break it down. But there's other oils that can break down gallstones as well. But peppermint is a very good first choice. And the other thing that's good about the peppermint for this is peppermint is how you really like stimulate proper function of the organs, like whole body function, but specifically here the organs, but it will stimulate the liver to detoxify as well. So you're hitting a lot of marks or markers or whatever you want to say, all with the peppermint. And peppermint tea would be okay. Peppermint oil would be better. If she's gonna do tea, she gotta drink tea all day.
Okay.
Really strong tea, like but you might even like if she doesn't want to take the oils internal, have her go to the health food store and just buy some peppermint capsules or a tincture of peppermint or something.
Oh, okay. I see what you're saying.
Yeah.
Um,
Well, the oils would be the most potent, but get peppermint in her. Like it will reduce inflammation, and if there's gallstones, it will reduce that. It will make the liver let go and start detoxifying. It does so many things. The only thing I would say is like maybe 2 or 3 hours before bed, no peppermint. And the reason being it relaxes the sphincter of the stomach. And what will happen is she'll get like heartburn when she lays down, because like if she takes it during the day it won't happen, but if she takes it like right before bed, when she lays down the sphincter will open and then stomach acid will go up the esophagus.
oh, wow.
So just 2 or 3 hours is usually enough.
2 to 3 hours before bed,
Yeah,
cut it off.
yeah,
Okay.
just cut it
And
off.
then,
Yeah.
but 3 drops in water 3 times a day, 2 or 3 times.
Probably twice is enough, but if she she's probably wanting to be super enthusiastic about treating it right off the bat, first few days she could do 3 times. But after that, you can drop it down to 2. I mean, she should start feeling better like within a few days.
Okay.
Yeah.
I think she'd be so
Maybe
grateful.
not completely, but she should feel like she's moving in the right direction.
Excellent. Thank you, Greg. Thanks so
You're
much.
so welcome. You're so welcome.
I appreciate it. And thank you for the crystal. Okay.
Oh yeah.
Okay. All right, I'll let you go. Thank
Okay.
you.
You're
I'm
so
glad you're feeling better.
Oh, thank you, thank you. Yeah, I had a rough night on Wednesday, but I felt better Thursday.
Oh,
Samantha worked
good.
magic, so like good.
I'm glad you could work your magic.
Yeah,
then.
yeah. You know, it's like it's one of those things where I've had that injury for, God, I hate to say it, but like 35 years. I've gotten good at like pulling myself out of the crisis, and so, you know, it's one of those things that happens sometimes.
Thank goodness that
Yeah.
you're good at it.
Yeah, lots of practice.
And I just want to add a little 2 cents worth because I don't know who's going to listen to this, because peppermint oil is one of the most common ones if you go to a health food store.
Yeah, you want to use like that's where you're going with
Yeah.
it. Use genuine peppermint oil because the peppermint in the health food stores is adulterated. So just only use peppermint oil when you know that it's genuine. If you're not sure, then go to the herb or something like that.
Yeah.
Okay.
It's just, it's one of those.
Yeah. It's a very, very commonly adulterated oil. Very common.
Could she, like when I was checking out Whole Foods, I bought like a little package of fresh mint, but it could be spearmint. It says mint, but
Spearmint
not as effective.
will work, but not as strong. It's like spearmint is like a weaker form of mint. I mean, it still has an impact, but you want peppermint, and like she would have like like fresh, she would have to eat like a bunch.
Okay.
Yeah, so easier to do it like in capsules or the oil or a tincture or something because it's more potent.
All right. I'll let her try to figure that out, or I'll be glad to obviously share your guys' name and your product. You know how to get a hold
If she
of
has
you
questions, let me know too. Like, yeah.
Oh, thank you. Thank you.
You're so.
And then go ahead, Channing, then Chris.
Hey, Miss Channing.
Hi, Greg and Sam. I have magic. First of all, I'm still collecting myself from that last practice.
Oh yeah.
Still hanging out in a different dimension.
Yeah.
Write down my question because I forgot about it when we came back from that little
Super strong. Yeah.
super incredible. Okay. Greg, thank you for reconnecting me with 2 really good friends, my back solar plexus and my basic.
Right.
Long lost friends there. I have one question and it has
For
2.
most people, it's the how do you say it? Frenemy.
I
Like
guess
the back
so.
solar plexus is usually so full of whatever.
I completely it was like finding gold again when you led me back to that practice, and I forgot that it was related to the Bogua, and it brought back all my training in 5 elements and in feng shui. So first of all, thank you for that. So my question has 2 parts. The first one is, can you please help add a little bit more flavor? I went and just reabsorbed the notes. I went back to our recording, followed those 2 sections, and I'm trying to work it over and over again. By the way, I am falling asleep 3 or 4 minutes in each time, and I have to go back and start over again because it's really hitting me strong. I wanted to ask more about the back solar plexus and the basic.
Sure.
And if this is getting too heady, please let me know.
Okay.
I am curious if there is a relationship or a significance between these chakras to the corresponding areas. So back solar plexus in the position of the south for the theme that we're
not so much the directions, but the topics.
Okay.
Yeah, it's yeah. You know, the thing with the Bogua, like it's like a search grid, you know, on how to go through and establish it. But when you start working those internal pieces, the directions, there's almost like an internal feng shui that happens, and the directions stop having the same impact. You know, you work the directions to stimulate certain processes in the body, be it releasing or strengthening or breaking down, or, you know, whatever it might be. And so when you're doing like an external feng shui practice, the directions are very important. But when you're doing the version like what we taught, like, you know, because I called it what we called 8 materializations of Metatron.
Yep.
At first I was going to call it inner feng shui, and I was like, it's going to be too confusing because people are going to be thinking about feng shui all the time, you know, like, so I stepped away from that idea because you're doing like a mystical version. It doesn't mean that like when you're doing the external, you still can work that stuff like in your environment and everything, but for the process itself, it's tied more to the energy center and how that energy center like functions with each of the topics that it's associated with.
Should I just forget about the Bogua altogether for this?
No, I mean, we still use it like in the house and stuff. Like, you know, I always
It's
like
on
in
the
it
cover
like
of the
this.
book, by the
Yeah,
way.
like right. Like the like harnessing the Bogua is like riding escalator going down and you're going down. Not embracing the Bogua is like going on the escalator going up. Or yeah, you're going up, but the escalator's still going down. So you can do it. It just takes more effort, right? And so the Bagua is very good for aligning like the environment and making it so things flow. But even if you had like bad feng shui, but a stronger like inner sense, a lot of times you would manifest or arrange the environment accordingly without really thinking about it, but you would overcome bad feng shui. I don't want to say easily, but kind of easily. And so, but the thing is the more you work those aspects, those 8 aspects, it's almost like the inner, like that inner feng shui begins to manifest and just makes sense to you when you go like, I don't want that there, I want it here. And it's because you have the like instinctual drive to align things in particular ways. So I mean, we still use it, like our doors a certain direction, and you know, our bed's a certain direction. We do certain things with the stove, you know, we still do all those things. We're not fanatical about it. You know, I'd say that's one thing is, you know, like when I was younger, if I went into a hotel and the bed was in a different direction, I was like, bah, gotta rearrange the room. And now I don't care. Like, yeah, 1 night, 2 nights, whatever. Or I put in, you know, if it's like a really bad direction, I stick a statue by my bed or a little tonka above my head or something like that, and I call it good. You know, I don't get too worked up about it. So I would use it, but I wouldn't get crazy about it.
Okay.
Yeah.
How is the back solar and the basic related to their respective areas?
The back solar, if I remember right, is
First
reputation.
aspect. Yep.
Yeah.
Second, the
So
basic.
like if you were to do healing on somebody and like people were grinding on them, or they had like not so good a reputation, or that's where it manifests, like in the back solar. And so, you know, the solar plexus is like it's like the clearinghouse between energy moving up and down. Like, so it's part of the higher centers, it's part of the lower centers, and depending on how well it's functioning, It's how they kind of connect, you know, or how well they connect and interact. And so when there is external difficulties, part of why you're working that is you're flushing those difficulties, which will eventually manifest in your physiology. You're flushing that out so that you're not always living in the past. You're always like kind of upgrading to something new so that you can affect like a kind of change for it.
Mhm.
And then the second one being, what is it, career or
Yep.
prosperity?
Life path, yeah.
Yeah.
Prosperity is
So
different.
that's about generating income, you know, finances, producing a result, constancy of effort, being practical, being realistic. You know, it's about like you creating something that over a period of time is going to keep giving or keep producing without you having to put the same amount of effort into it all the time. It's very survival oriented. So the life path is tied to, the basic is tied to the life path because of like what it does to manifest like your direction in life. You know, you're not all head in the clouds or being too idealistic or have a
Yeah.
fantasy. It's very grounded, very, 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 very practical.
Okay.
Yeah. Yeah.
Wow. Yeah, that's pretty amazing, actually.
Yeah.
And I love the way that it's laid out in the book
Yeah.
too. So,
Yeah.
speaking of magic carpet ride, can
Mhm.
you suggest if there is an incense or something I can, if there's an incense I can burn while I'm doing these two practices,
So
or
you could
or
burn
crystal?
orange healer, you could burn poplar, you could burn aloes. Um, I even like the idea of burning the cedar.
Mm-hmm.
You know, I'd say any of those are good choices. Um, another one that we have Cistus on the site, right?
Yeah, I
Yeah.
double check.
Yeah, Cistus would be another one, but I would say that might not be your first round, but eventually I would say that could be like a deeper practice.
Ooh, I like
Yeah,
that.
yeah, I know.
Deeper.
Yeah, Cistus is quietly magical without drawing attention to itself.
I love the oil.
Yeah.
First of all, I love how it
Yeah,
smells.
yeah.
Oh, and speaking of smell, have you smelled the back solar plexus lately? Oh my gosh.
Yeah,
Okay, that statement out of context is hilarious. Oh, we're really close on
yeah,
time. So.
yeah.
It smells so good.
Right.
Okay. I think that was
Good.
it.
I'm glad you're enjoying it.
Oh my gosh, yeah. I'm falling asleep every time because it's so strong,
Perfect.
but
Yeah, it's
I'm
hitting the mark.
really,
Yeah,
I'm
it's
really
hitting-
loving it. And I was just doing cartwheels when I started digging into the notes, and you're like, this
right.
class, it's the feng shui class. I'm like, what?
Yeah, yeah, yeah. Yeah, I didn't present it like that just because people, you know, there's different approaches to feng shui, different
Oh no, I get
theories,
it.
and
Yeah.
so I just left all that at the door and just, you know, did the mystical version of it. Yeah,
Yeah.
yeah.
Cool. Thank you.
You're so welcome. Let's squeeze in one more. Who's
Yeah, okay.
Yeah.
Go ahead, Chris.
Hey, Chris.
Thanks, Sam. Hey, Greg. Quick
Hey.
question.
Mhm.
If I am trying to disintegrate thought forms,
Mhm.
what's a good mop up spray? Like quick, if the most efficient one.
Quick, worth platforms, and we're pretty sure they're more mental, not emotional.
How about across the board,
Across
mental and emotional? Yeah.
Probably aloes.
Okay.
Like if you want to be less fancy, you could do
Like, let's say general public.
right. Palo Santo.
Thank you so much.
That like aloes would still be the premium choice. Palo
Okay.
Santo could be the workhorse. You know what I mean?
Gotcha. Yeah,
Like
yeah.
you go crazy with that, you might not want to go crazy. And like when I say aloes, you could just use like aloes C or like white oud or something like that. It doesn't have to be the super fancy aloes, but
Mm-hmm.
like in practices, you probably even see like is my forehead discolored right now?
No, you're okay.
Okay. But like sometimes you might see my forehead's a little discolored. It's because I rub aloes for the same idea. Like just to let go of
Gotcha.
thoughts. Yeah. So aloes like on the forehead on the ajna. It's like a mind sweep.
Love it.
Yeah.
Thank you so much.
You're so welcome. Okay. Did we get everybody or yeah.
I mean, Lolly had her hand raised.
Yeah, I'm sorry. I have to jump into another Zoom. So if you still have a question, send us an email but we'll have our study group on Wednesday night. But my apologies. I do have to jump into another thing.